Assalamu alaikum. Today we have Dr. Rizwan Azami with us. Assalamu alaikum, sir.
I'm fine, thank you.
So this is how we start. आप कहाँ पैदा हुए थे?
मैं कहाँ पैदा हुआ था? I was born in Bannu.
अच्छा.
Yeah.
Okay.
So that's where my father was posted. My mother was with him, of course. I was born there.
And what kind of a childhood did you have?
What
kind of a childhood did you have?
Well, I would say a very unstable one, in sense that I was. My father was in the army, and every time he moved, we had to move. Yeah. So I kind of spent time in Karachi, I spent time in Lahore, I spent time in Pindi, I spent Peshawar, Kohat, Dhaka, Chittagong. Of course, my longest sojourn was in Karachi, because that's where I graduated at Joint Medical College. Things became a little stable and steady after medical college, when I stayed in Karachi all along from that point onwards.
Oh, okay. And how were you as a kid? Were you an extrovert, an introvert?
How was I? I don't know. I guess perhaps I was. I would say that I was neither an introvert nor an extrovert, but I certainly wasn't an extrovert in the genuine sense of the word. You know, if somebody asked me to do something, I would do it, not a problem. Yeah. But I wouldn't volunteer for stepping onto the stage and doing a dance.
Okay, understood. And where was you, like, since you've been to so many places, what was your longest duration of schooling from?
Longest duration?
As in where, the stabler school?
Well, I don't think there was any stability there at all. It was 2 years in each one of these locations. And perhaps Rawalpindi might have been my longest stay, maybe. But certainly Karachi was my longest thing with Dow Medical College.
And what made you go into medicine?
Good question. If I'd had a chance, perhaps I wouldn't have gone into medicine.
Achha.
Okay. I was... my father was a doctor, so he would probably desired me to go into medicine. He didn't say it in so many words, but one could sense that, he'd like me to go to medicine. He left us all, actually, to do what we wanted to do. But at a time, I'm talking about the 1960s, you either went into medicine or you went into engineering. And if you couldn't go to any of these, you went into the army.
Okay. So you did not like engineering or army?
I could have gone into engineering, but I hadn't taken maths.
Okay. So?
Advanced maths. I took basic maths. So I didn't take up maths. So that was one very bad decision on my part, perhaps. But then it was not just my part, it was also the school's part. There wasn't any
advanced math
there either. So I went into biology, and I found that interesting enough. And that's how, I guess, eventually I went into medicine. And then finally I settled with the idea that, one career or another, it's a lifetime piece of work, by the way. So let's settle down and do it, whatever it is.
Okay. And which medical school did you go to?
Which?
Medical school.
Dow. I was in Dow Medical College. So Aga Medical College tha, because Karachi University was the one that was awarding us the degree at that time. That's how it was.
And how was medical school for you?
Ji?
How was medical school?
Not nice.
Sure.
Not nice at all. Well, I flunked anatomy, I flunked physiology, I flunked pharmacology. I went back to anatomy on 2 occasions for the simple reason that I wanted to find out whether it was the subject I hated or the teachers.
And what did you find out?
I hated the teachers.
And
they were bad. The same went for physiology. The same went for pharmacology. Pharmacology, by the time I got into pharmacology, it was third year, so they couldn't chuck me out of medical school. So I was a bit of a nuisance for the teachers there. They were talking about how to write drams. And I said, this shouldn't be done. And I said, this is likely to cause confusion in interpretation and errors in calculation. So why do you want to use this same symbol? So exam mein argument ho raha hai. It's a bad time to have an argument. I said, it shouldn't be done. And he says, what do you mean it shouldn't be done? I said, well, I think it causes confusion.
Yeah.
And that's why, and this is 1969.
Okay.
I said, I have a book dating back to 1939.
Okay.
That says that this was decided that in Geneva that this symbol should not be used.
Why are we still using it?
And he said, "Jhoot bolte ho." I said, "No." And this gentleman who was accusing me of this happened to be my father's class fellow. He didn't know that.
Okay.
I never told him. But my father had already indicated to me, be careful of that gentleman. You know, he's got a problem, chip on his shoulder. So anyway, to cut a long story short, he says, "Jhoot bol rahe ho?" I said, "No, sir, I'm not. I can get you the book. In fact, if you give me 2 minutes, I'll get it for you."
Okay.
तो वो नाराज हो गए. उन्होंने बोला कि बाद में मुझे दिखाना. But by the time I had been failed, so बाद में मैंने उनको दिखाया. He had nothing to say, but he had done what he had to do.
Yeah.
So I paid a penalty for that. But anyway, I looked at it like this. But I still went back to the subject of anatomy for the simple reason that I said that I must know whether it's a subject I hate or the people I hate. It turned out I didn't like the people too much. I got thrown out of the first class of anatomy anyway, mainly because of a typographical error by somebody else.
Okay.
उन्होंने मुझे गर्ल्स के बैच में डाल दिया. I was the last girl in the batch. I sat with the first class. I went and sat with that demonstrator. The demonstrator looked at me after a little while and said, "What are you doing over here?" I said, "I'm in the batch." He says, "You're not in the batch. Get out of my class." I said, "No, I'm in the batch." He says, "Get out of my class." First floor se unne took my apron, he threw it out. She threw it out. Get out. So I went out and I looked at the list again. Their roll number 39 tha. So I went and I looked at the list again and I said, "Oh, why am I a girl?" उसने क्या किया? मेरे नाम का R के साथ आजमी का A रिजवान के साथ लगा दिया, तो मैं रिजवाना बन गया. So I went to the clerk and I told him, I said, "What have you done? You put me as a girl. I'm not a girl." He looked at me and said, "What?" I looked out the list. He says, "Changed it." And I became the last guy in the boys section. Yeah. I still remember that. So that was how it happened. But anyway.
So once you were done with your med school, where did you do your internship or your house job from?
I did all of that from civil hospital. Did my house job there in civil hospital. I did a house job in ENT, did a house job in medicine, and a house job in surgery. वहीं पर किया. And that's when I decided that I would not want to do medicine.
What made you decide for surgery?
You'll be talking about 1970s, 73, 74. Everything was clinical. Plain X-ray was contrast X-rays, bariums. Nothing else was available. Lab tests. There were only these modalities of investigation that were available. And the final investigation was post-mortem examination. The only thing that was there between post-mortem examination and the lab tests was surgery. And of course pathology. But you couldn't get to pathology without doing surgery. There was no question about doing fine needle aspirations or doing true cut needle biopsy. Nothing existed. The only needle that existed for biopsy was a Mangini needle for the liver.
Okay. Interesting.
And people were not willing to do that because of the complication rate. So that was, and then I had experience in medicine. Medicine was so speculative. It was all speculation. It was all, I say this and this is it. And you follow that and you don't have any choice other than that. And to get to that point where you were good at being a clinical person, I think you carried a lot of coffins on the way. Plus, I think I did perhaps, I wouldn't say it's क्या कहते हैं, the desire to possibly have been an engineer did exist.
Okay.
That was there. And I did want to use my hands. I was good at doing things with my hands. So surgery was a natural choice then. Less speculation.
More hands-on.
Intervention with your hands. And then gathering actual evidence for pathology and getting a definitive answer. So those are three good reasons for me to be a surgeon, I think.
And then what did you do? Like once you decided that you wanted to do surgery, how did?
Well, that was another bad situation. At that time, when you graduated, once you did your house job, it was compulsory for people to go to the army.
Okay.
And I didn't, even though my father had been in the army. I didn't want to go to the army. I don't know why I didn't want to go to the army. I just did not like the concept of going to the army. So I asked my father, I said, should I go to the army? He said, up to you. You want to go there, you don't want to go there. But he was a little upset with the army himself. So he didn't encourage me. So I didn't go. Yeah. The next thing I knew, I had warrants of arrest from the local police station. This man is an absconder from the army. He should be,
taken away,
picked up and presented to the board for examination. The only way to avoid going to be conscripted was to join basic subjects.
Okay. As a teacher?
As a teacher. So, Kudrat ka karna aisa hua ke there was a vacancy in anatomy at that time. And I wanted to, and I said, that's a good choice. At least I'll know for sure whether I hate the subject or the people. Yeah. So I joined anatomy in Dow.
Can we say you became the good teacher that you never had?
Ji?
Can we say that you became the good teacher that you never got?
No. I said, I'm not going to teach anatomy the way I've been taught. So I was going to do it differently.
Yeah.
So, and I did do it differently. But while I was there, I met a gentleman by the name of Samdani, who was much, much senior to me and much more experienced. He was there as a teacher. And he was going through a very bad patch in his existence. And he didn't know what to do. So I don't think I adopted him. Maybe he adopted me, I'm not sure. But we both needed each other in this sense. And he wanted to do, he was doing anatomy because he had no other choice. Either he was out of the service or he was going to do anatomy. I said, do you want to do this for the rest of your life? I said, no. This is a transition.
Yeah.
He says, what are you going to do? I said, I'm going to go do surgery. He said, maybe surgery karunga.
So.
I said, what are you going to do? He said, what are you going to do first? I said, I'm going to prepare for my part 1.
Mm-hmm.
He said, what are you going to do? I said, study anatomy, take your part 1. So we both studied anatomy. We did our part 1s together. He got through, I got through. Then we waited for appointment in the surgical side because logic ये थी कि भाई आपको part 1 हुआ होगा तो आप surgery में जाएंगे.
Okay.
He got it because he was senior, much, much senior. So he got appointment, I didn't. So I stayed back in anatomy for another year or so. And then I got into surgery. But while I was in anatomy, उस ज़माने में logic ये थी कि you could take your MCPS in surgery.
Okay.
So I took my MCPS in surgery and I passed. That gave me another additional bonus for coming into surgery. And I joined surgery training. That continued for quite a while. So that's now 77, 78.
Yeah.
Then he took his part 2. We completed training. We both completed training about the same time. He took his part 2. He passed. I flunked.
Okay.
So I took it again.
Yeah.
I passed in 83, 84.
Mm-hmm.
83. I passed in 83. Then I took Public Service Commission. And I found these guys acting funny with me. So I resigned from the government service.
Okay.
When I resigned from government service, उस वक्त मुश्ताक साहब थे Surgical 1 में. He was my trainer in a way. One of the people I trained with. So I was at a loss of what to do now that I've resigned from government service. What to do? So he said, तुम Aga Khan अभी खुला है, join कर लो.
Okay.
So, but I said, there's no surgical department there. He said, surgery तो नहीं है उधर, लेकिन join the anatomy department, and when the surgery opens, we'll see how it goes.
Mm-hmm.
So at that time, I was Aga Khan was not present over here on this University Road site. It was going to be beginning in the College of Physician Surgeons, 3rd floor and 4th floor.
Interesting.
So I went to the anatomy guys over there, and they were short of people. They said, "Oh, he's got a volunteer. Aa jao."
Right. Zabardast.
So I joined anatomy. That was March, April 1983.
Mm-hmm.
So very interestingly, I worked in anatomy from March, April, May, June, July, August, and no salary. उस जमाने में परवाह नहीं करते थे ज़्यादा। So the new class was recruited in 1983, October, I think it was. And I functioned in anatomy. In 84, I took the FCPS Part 2 again while I was there in the college, and I passed. Now, when I had that in my hand, I said, okay, fine. Now, whenever the surgery department opens, I'm going to have a shot at it. They said, yes, okay, fine. As it happened in 1984, end of 84, 85, beginning of 85, we moved to the University Road premises. ये तैयार हो गई इस जगह. उस वक्त तक 2 क्लासेस रिक्रूट हो चुकी थी. 83 की क्लास, 84 की क्लास रिक्रूट हो चुकी थी. So when we moved here, it was fine. I was still in the anatomy department. I was an honorary member of the biochemistry department and the physiology department as well. क्योंकि हम लोग वहाँ पर सारे शेयर करते थे. तो एक ही जगह, एक ही कमरा था, सब एक कमरे में बैठते थे. इधर एनाटॉमिस्ट बैठा, उधर पैथोलॉजिस्ट बैठा, फिजियोलॉजिस्ट बैठा, फार्माकोलॉजिस्ट बैठा. So that's how it was. So we were still a closed group, a very small group. Anyway, we moved here, we stayed, we worked here. I was with anatomy at that time. So then the surgery department began to function. 85 में जो 83 का बैच था, they wanted to come to the clinical side.
Third year हो गया उनका. हाँ जी.
So they had to come to the clinical side. There was nothing over here. There were no beds, no wards, no nothing. तो उतनी देर में तलाती साहब ने ज्वाइन कर लिया. I think he joined in 84, or I'm not sure. फिर मुश्ताक साहब ने ज्वाइन कर लिया, क्योंकि अब क्लिनिकल टीचिंग शुरू होनी थी. So then we used to take the batches for clinical teaching. We used to take them to outdoor sites. Masumin Hospital in Kharadar, Maria Lily Leprosy Center. These are 2 common places we were used to take the batches to. बैच छोटे थे, 50 लोगों के बैच थे, तो 25-25 के बैच हो जाते थे, तो 25 उधर चल जाते थे, 25 उधर चल जाते थे. And one clinical teachers used to go with it. Then I applied for the surgery thing. They said, okay, fine, और तो कोई है नहीं, तो ये इसी को ले लो. So that was how it was. I think. I'm not sure. Then gradually, slowly, the surgery department. उस ज़माने में the fun part of life was that we worked as a group, and whoever suggested anything, वो उसका baby हो जाता था. Yeah. And I still remember that when we started the wards. The only people who used to do surgical clinics was Talati Saab and Mushtaq Saab. There was nobody else.
Yeah.
I was not given that privilege at that time. I was still in anatomy and transfer nahi hua tha, but I was doing clinical work, clinical teaching, clinical methods. But then what happened was that they opened the wards. When they opened the wards, I remember the first person who got operated on was a nurse. She had appendicitis, and Mushtaq Saab operated on her, and she got a wound infection. Mm-hmm. And she landed up with a wound infection, and she landed up in the ward. I was there. And so she got a wound infection. I opened the stitches. drained her, everything was on. I did that on the ward. No charge, no nothing, no record, no registration, nothing. All informal.
Fair.
Next morning, I told Mushtaq Saab, I said, look, this is what happened. This lady came and she had this problem and I opened a wound. He says, she's okay? I said, yes, she's fine. Uspe, this is strange. I said, yes, it is. It's not nice. Yeah. It's not right if patients walk into the ward where they're already admitted and they get treatment and they walk out and no record of what has been carried out. How can this happen? Yeah. He said, what do you suggest? I said, there should be an emergency room which they should come. He says, you open the emergency room.
Okay.
The hospital wasn't ready. Okay. So he says, what do you do? I said, जिधर आप क्लिनिक करते हैं वहां पर हम इमरजेंसी खोल देते हैं. हाँ. So then we all walked down to the clinic. CHC. अच्छा. और उन्होंने कहा कि हम क्लिनिक इस कमरे में और इस कमरे में करते हैं. ये कमरा इमरजेंसी होगा, ये आपका इमरजेंसी रूम होगा, ये आपका कमरा होगा, ये इमरजेंसी रूम होगा. तो जो CHC का जो माइनर ओटी था वो इमरजेंसी एरिया बन गया. उधर काउचेस लग गए 3-4 और ये हमारा ऑफिस हो गया उसके ऑपोजिट. And that's how the emergency started. I said, that's not enough. We need people 24 hours. I can't do 24 hours. I do 18 hours over here. I need to take time off. He says, okay, so recruit people. So we recruited 3 people. Awesome. For 24 hours. और वहाँ पर फिर emergency शुरू हुआ. अब जब उधर शुरू हुआ, then they started putting pressure on these guys to make the real emergency room. Yeah. And then the real emergency room came up next. Interesting. So then we all migrated to the real emergency room.
Zabardast.
So that was how we set up the new emergency room. So I ran the emergency room. I was the resident ENT surgeon, resident gynecologist, resident...
everyone?
Everything except general surgeon and urologist.
Okay.
लेकिन emergency urology भी हम ही करते थे. Catheterization, ये वो. फिर मुश्ताक साहब और तलाती साहब को हैंड ओवर कर देते थे. Orthopedic surgeon. There was no orthopedic surgeon. So I did a lot of orthopedics there. And behind me, because of the orthopedics, behind me was a very nice surgeon by the name of Maqbool Siddiqui, who had both hips replaced with prosthesis and had rheumatoid arthritis, bad rheumatoid arthritis. He couldn't put on gloves. Oh. But he was an orthopedic surgeon. Very well trained, very nice man. So he would come, he would do this, he would supervise the surgery and he would sit behind in the theater.
And you would do everything.
And I would do the surgery.
Awesome.
So, hips, long bone fractures, this, that, and the other. Ye sab cheezein karta rahe. For 2.5, 3 years that was done. That was there. Then before we got an orthopedic surgeon. And when we got an orthopedic surgeon, I handed all the orthopedic work to him. And again, I was nothing much else to do. So, very interesting situation पैदा हुई कि वे I was getting a little restless in the ER. I said, I can't do this for the rest of my life, you know. I didn't want to. By that time, Dr. Mausam aa chuki thi. She didn't want, she wanted somebody with in the ER who had ER credentials. I said, fine, suits me, fine. I don't want to be here. I've done what I wanted to do. But that was I think an invaluable experience, because I did so many things that anybody else under normal general surgery would never do.
Yeah.
Never get a chance to do, because it's no longer the same practice anywhere. You know, from medicine, surgery, ENT, pediatrics, everything.
Yeah.
Trauma, everything. Medical legal cases वहाँ पर बनाए. पहला आपका mass disaster plan हमने बनाया. क्योंकि वो पैन एम का डिजास्टर हुआ, I was there. तो जब सर्जिकल ओटी बनाने की बात है, तो सर्जिकल ओटी में बोला स्टरलाइजेशन सप्लाई डिपार्टमेंट कौन करेगा?
सही.
You know, okay. पैक्स नहीं थे. Something interesting happened. पैक्स की रिस्पॉन्सिबिलिटी जो थी वो नर्सिंग को दी हुई थी. तो नर्सिंग ने बड़ी इंटरेस्टिंग हरकत करी. उधर जो उनको नहीं पता था, उन्होंने बोला जी हाँ हम सर्जिकल इक्विपमेंट ऑर्डर कर देंगे, इंस्ट्रूमेंट्स ऑर्डर कर देंगे. Is this going to get recorded now? You're going to cut this portion out.
Okay.
वो जो डायरेक्टर नर्सिंग थी उसने 10,000 सिजर्स, 10,000 फोर्सेप्स और 10,000 किडनी डिशेस और 10,000 सिजर्स ऑर्डर कर दी.
10,000?
और ये थैकरे को इंग्लैंड में ऑर्डर भेज दिया.
जबरदस्त.
परचेज करे. तो हमने बोला सर्जिकल इक्विपमेंट की लिस्ट कहाँ है? तो मैंने बोला इसमें तो 10,000, 10,000, 10,000, 10,000, 10,000, लेकिन बाकी सामान कहाँ है?
बस यही बनवाया.
उसने बोला मैंने तो अब जो मुझे चाहिए मैंने ऑर्डर कर दिया, बस मुझे नहीं पता, आप लोग ऑर्डर करें. बोले यार तुमने ऑर्डर भेज दिया,
और हमें बताया भी नहीं है.
फिर बैठ के सारे सर्जिकल पैक्स के लिस्ट्स बनाए.
सही.
वो जब पैक्स की लिस्ट, आज तक वो पैक्स की लिस्ट है. मैंने उस पैक्स की लिस्ट को आज तक है, मैंने 2012 के अंदर कोशिश किया कि ये पैक्स की लिस्ट कम की जाए, चेंज की जाए. मैं नहीं कर पाया. इतना रिजिड हो गया ये सारा सिस्टम.
You made this?
Yeah, but I couldn't alter it because by that time it was no longer in my hands. ना मेरे हाथों में नहीं था. मेरे हाथ से बच्चा मेरा निकल चुका था.
बड़ा हो गया बच्चा. वो
किसी और के हवाले था, किसी और खानदान के हवाले चल रही. तो दिस इज हाउ इट हैपेंड. तो वो ऑर्थोपेडिक इक्विपमेंट ये सब उस वक्त तक फिर बनू के हम लोग बैठ के सर्जिकल स्टरलाइजेशन सप्लाई डिपार्टमेंट भी बना, वो भी देखा, वो भी बनाया, उसके भी सिस्टम बनाए. स्टोर, सर्जिकल स्टोर के सिस्टम बने. तो दैट वाज I think an amazing experience I had. I wouldn't have changed it for the rest of my life. It was worth it. It was amazing.
Awesome.
इस तरह के काफी सारे.
Do you remember your first surgery that you did here?
My first
surgery as a surgeon.
First surgery. Oh yeah, first surgery was very, very interesting. The first surgery was trauma. This was a guy who was in our workshop. उसे हाथ की क्रश इंजरी हो गई. His hand got stuck between the wall and a crate. और वो forklift के साथ वो उठाने की कोशिश कर रहे थे, बहुत भारी था. तो वो पिचक गया. Anyway, that was my first thing. That's what I remember. But the most interesting part was the medical legal side. And emergency room खुल गया था, तो इन्होंने कहा कि मेडिकल लीगल केसेस नहीं लेने. मैंने बोला कैसे आप नहीं लेंगे, आपको करना है. अकॉर्डिंग टू द लॉ यू हैव टू हैंडल मेडिकल लीगल केसेस. यू कांट जस्ट से कि हम नहीं ट्रांसफर आउट करेंगे. मैंने बोला आपको फर्स्ट एड तो देनी है. और फर्स्ट एड आपने दी नहीं और आपका केस वो बना नहीं. आपका वो केस बन गया, तो आपको करना पड़ेगा.